According to the Centers for Disease Control, there is a virus that more than half of adults in the U.S. will get by the age of 40. It's called Cytomegalovirus, or CMV. It's passed through bodily fluids, and most people who get it have absolutely no symptoms.
However, if a woman gets it while pregnant, their baby could be at risk for serious health problems. And surprisingly, only a small percentage of women in Maine and across the country are warned about this infection. News Center Maine's Vivian Lee has more in this report.
Laura Sweet's daughter Jane was born in November of 2014.
I had a completely normal pregnancy, full term. She appeared totally healthy at birth.
But Jane failed her newborn hearing screening. Nearly a year of seeing different specialists, her daughter was finally diagnosed with congenital cytomegalovirus, also known as CMV. CMV is a common virus often circulating in daycares. It can present like the common cold or flu or no symptoms at all, but it can lead to severe complications to an unborn child when the mother is newly infected while pregnant. Laura had been advised to refrain from alcohol, certain foods, and handling kitty litter, but was never told about CMV by her doctor. The virus is often spread by saliva and urine. Laura's young son was in full-time daycare at the time.
There are really simple things I could have and should have, been doing had I known, like not sharing utensils with him, not sharing water bottles with him.
The CDC says 1 in every 200 babies are born with CMV, and about 20% of babies infected will develop health problems. It's the single most common infectious disease that causes brain injury, developmental disabilities, and hearing loss in children across the country. Dr. Andrew Tenenbaum is a pediatrician who has diagnosed CMV in children.
One end where kids could have it and have no symptoms, to the other end where they can have devastating neurologic impacts and developmental delays and seizures, autism, and profound hearing loss.
Kelsey Gagney's pregnancy with her daughter, Haley, had no complications. Her baby girl passed her newborn hearing test. But at 15 months, her daycare provider noticed Haley wasn't responding to her name. Kelsey, who is an occupational therapist, was blindsided when her daughter was diagnosed with CMV.
And that's what makes me mad, is that if there was a screening or if I had a pamphlet or anything, and it said CMV can cause hearing loss, and I would have been watching for the hearing.
Haley was fitted with cochlear implants later than most babies who fail their hearing test, but she is developing normally.
Mama called the doctor and the doctor said.
Now 2 years old, she is learning to count and loves doing music therapy. Jane had her implants by her first birthday and is thriving now in kindergarten. These moms are lobbying to educate all women of childbearing age, as well as doctors in Maine, about the risks and how to prevent CMV. They also want universal screenings, testing for every baby for CMV at birth to catch those who may have not had the obvious signs like hearing loss.
If the babies are identified, they can be monitored. And if any of those things were to come up later in life, families know to watch out for them.
Purple eggs.
Helping these children get key intervention services early on for better outcomes over their lifetimes. In Portland, Vivian Lee, News Center, Maine.
A working group was directed by state lawmakers several years ago to come up with a list of recommendations to address CMV in Maine. That included testing newborns for CMV if they do not pass their newborn hearing tests. Those recommendations will be part of legislation that is expected to be introduced this fall.